to immune disorders. This is from the Applied Science Human Biology for the Unit 1 exam content. So autoimmune disorders are chronic conditions that develop from the immune system attacking healthy cell tissues that should normally be left alone. Diabetes, so type 1 diabetes is where the pancreas, the beta cells in the pancreas do not produce insulin, and the patient is dependent on insulin injections for survival. The symptoms of type 1 diabetes are frequent urination, unusual thirst, extreme hunger, unusual weight loss, extreme fatigue and irritability. Treatment of diabetes is insulin injections for type 1 and diet management. That can be for type 1 or 2. Multiple sclerosis or MS. So multiple sclerosis is where the myelin sheath begins to break down, and this disrupts in the nerve impulse conduction. So the symptoms of MS are visual disturbances, weakness, fatigue, loss of muscular control, speech disturbances. The treatment of MS is focused on the alleviation of symptoms, avoidance of conditions that hasten the progress of the disease, avoid emotional stress, viral infections, eat a healthy diet, get adequate sleep, and you can also take drugs that interfere with the immune response to subdue MS during relapses. And to slow the progression of MS, you can use a drug called interferon B. Crohn's disease is a chronic inflammation of the intestinal tract, and the symptoms are abdominal pain, diarrhea, cramping, pains after meals. Client usually decreases food intake, causing weight loss, malnutrition and anemia. And the treatment are anti-inflammatory steroids or immunosuppressants. Rheumatoid arthritis. Rheumatoid arthritis is a chronic systemic disease characterised by autoimmune inflammatory changes in the connective tissue throughout the body. Symptoms of rheumatoid arthritis are pain in the joints, restricted movement, stiffness, weakness. The risk factors of rheumatoid arthritis are being female, family history, advancing age and smoking. And the treatment of rheumatoid arthritis is aspirin, NSAID, physical therapy and steroids. Primary immunodeficiency diseases result from some genetic or developmental defects, develop usually in infants and young children. Secondary immunodeficiency diseases is loss of the immune functioning as a result of an illness or treatment. So an example of that would be AIDS. So there is a separate video that I've done on HIV and AIDS, which is also on the syllabus, so make sure you've also watched that as well. SCID, which stands for Severe Combined Immunodeficiency, is an inherited disorder in which both T cells and B cells are absent or inactive. The symptoms of SCID are frequent coughs, colds and infections in the first few months of life. There would be an absent thymic shadow on an X-ray, and they would have small tonsils. Chemotherapy can also result in immunodeficiency, so the immune system is less able to protect against pathogens because of the chemotherapy. Organ transplant rejection is when the immune system thinks that an organ transplant is a foreign invader because it has different antigens and attacks it. Patients must take immunosuppressants to prevent this, but this reduces the production of white blood cells, so therefore they're more susceptible to other infections. Allergies. This is where the immune system overreacts, which causes symptoms associated with allergic reactions, which is kind of overproduction of histamine. Allergies and asthma primarily involve overactive components of the immune system, inflammation of the diameter of the trachea and bronchioles, and overproduction of the mucus. So there is a narrowing of the trachea and bronchioles, which makes it more difficult to breathe. And the treatment for asthma are bronchodilators, so inhalers, and corticosteroids. Or you can also get steroid inhalers as well as oral steroids. Anaphylaxis is a severe allergic reaction that causes airways to tighten and blood vessels to leak. Anaphylaxis treatment is secure the airway, give supplementary oxygen, give an epinephrine injection, which is like an EpiPen, and also antihistamines. And the symptoms of anaphylaxis are skin, hives, swelling, redness, respiratory, coughing or wheezing, gastrointestinal nausea, stomach pain and cramps, cardiovascular dizziness, weak pulse, neurological anxiety, feeling of impending doom. Dermatitis is inflammation of the skin, and the treatment for dermatitis based on cause is corticosteroid creams and oral steroids.